Providing support for the skull are the bones that comprise the remainder of the body. Like the bones of the skull, the bones of the body come in many different shapes and sizes, each serving a specialized function. These too are living, dynamic tissues growing and changing radically from birth to adulthood. A good way to learn about the human skeleton is to compare the skeletal frame of a baby with that of an adult.
This is the skeleton of a newborn baby that died at birth, and the skeleton was donated for us to use for teaching. One of the things you can see immediately from looking at the baby is how big the head is compared to the rest of the body. What we were talking about before, about the size of the brain compared to the face, it's very large, and so the baby's head is very large. But when you compare it to the rest of the body, it really looks huge. The babies are mostly head, and then there's a small body that follows. But the body has to catch up and do a lot of growth. The way it does that is it doesn't form completely in bone at birth. So most of the skeleton of this baby is actually cartilage. And the bone will ossify as the baby is growing. So if you look carefully at this baby's skeleton, all of the joints are cartilage. Here's the shoulder, the elbow, the wrist area. The connections in the front for the ribs are all cartilage. The sternum is in 1, 2, 3, 4 pieces. If we look at the lower extremity, you see, again, cartilage on the hip, the knee, all throughout the foot. And even the pelvis is broken up into different pieces with cartilage. And the backbone is fairly straight. You look at a baby's backbone, very straight, no curvatures. We'll get curvatures as we start bearing weight, but babies, as you know, are not walking yet. So they're not bearing weight, and they don't have all of the support that we have in our adult skeleton. And the very back of the skeleton, you can also see, is not closed yet. There's still some openings here where there's cartilage. If we look at the adult backbone, there's no cartilage anymore. And we have curvatures. We have a curvature in the lower part of the back, a curvature in the chest region, and another curvature again in the neck region. So we've got this zigzaggy shape to our backs that helps us to support the load that we bear as we're walking. And while there's no cartilage, we do have discs in between each vertebra. So we're looking at a backbone that's flexible because of these discs, so it can bend forward and backward. And if one of these discs were to rupture, we'd have what's called a slip disc. It doesn't really slide out of place. What ends up happening is a portion in the back bulges, and when it pushes backward against one of these yellow things, which represents nerves, these are all your nerves coming out from your spinal cord, then it can impinge on that nerve and you get pain. At the bottom of our vertebral column, we have the sacrum, which is really a series of fused vertebrae to which the pelvis is attaching. And at the very tip of that, we have something called the coccyx, which is a series of little bones that narrow to a point. They look like a bird beak, and coccyx actually means cuckoo's beak. And this is your pelvis, or hip. The hip has another pad right over here that allows for movement in the pelvic region. This is particularly important for women for childbearing because the hip has to spread open to allow the baby to pass out of the vaginal canal, the birth canal.